Hello everyone and welcome back to MediInsights. Today we're exploring Baclofen capsules, a commonly used muscle relaxant for spasticity. You'll learn what it treats, how it works, typical dosing, common side effects, and practical safety advice to use it effectively and safely, with clear tips for patients and caregivers now. Let's talk about the conditions Baclofen helps treat. Baclofen is prescribed mainly to treat muscle spasticity from conditions such as multiple sclerosis and spinal cord injuries, and it helps reduce painful muscle tightness and spasms so you can move more comfortably. It is a skeletal muscle relaxant that acts on the spinal cord to lower reflex activity and relieve associated pain, improving daily function for many patients. Here's how Baclofen should be taken and how much to use. Doctors usually start adults on a low oral dose and increase it slowly to find the right balance between benefit and side effects, commonly beginning with 5 mg 3 times daily and titrating toward 20 mg 3 times daily as tolerated. Your prescriber will space doses evenly through the day and may adjust the schedule for older adults or people with kidney problems, so follow their directions carefully. Never change or stop your dose without medical advice because dosing needs individual adjustment. Let's talk about how Baclofen affects your body or symptoms. Baclofen works by activating GABA-B receptors in the central nervous system, which reduces the release of excitatory neurotransmitters and suppresses the reflexes that cause muscle spasms. This GABA-B agonist effect produces muscle relaxation primarily at the spinal level, which explains its benefit in spasticity disorders. Researchers continue to study additional effects, but the core action is inhibition of overactive spinal reflexes. As with any drug, there are possible side effects to watch for. The most common side effects you may notice are drowsiness, dizziness, weakness, and nausea, which often improve as your body adapts to the medicine. Some people can experience confusion, low blood pressure, or trouble concentrating, and severe reactions like seizures or high fever have been reported with abrupt withdrawal or overdose. If you or a caregiver notice sudden worsening of mental status, breathing problems, or uncontrollable fever, seek urgent medical help. Lastly, some important reminders and precautions. Do not stop Baclofen suddenly. Your doctor will usually taper the dose gradually because abrupt discontinuation can cause hallucinations, seizures, high fever, and rebound spasticity. Tell your prescriber about kidney problems, because Baclofen is cleared mainly by the kidneys and doses may need to be reduced to avoid toxicity. Avoid alcohol and other sedating drugs unless your doctor approves them, and mention all prescriptions and supplements you take to reduce interaction risks. Always store your medication safely and keep follow-up visits so your clinician can monitor benefit and side effects. Thanks for watching. I hope that clarified Baclofen for you. If you found this helpful, please subscribe to MediInsights and hit the bell. Leave a comment with questions or topics you want next, and stay safe with your medication always.